We've been talking about two things. The first is the so-called e-health ambassadors program, which is a very interesting program which is chaired by Desmond Tutu. We're both very involved in that. Ricky's the chairman of that, along with Tutu. And then I've been talking a bit about current medicine and where it's going, and the developments of molecular-based medicine.
There's a lot of lessons we've learned and mistakes made in various projects, including the National Programme for IT, which was not a success, and building on avoiding the pitfalls that afflicted that particular programme. Actually, we can make a big difference.
The Global Ambassadors Programme is really addressing problems, for example, in Africa. So to give one example of that, we're developing a programme whereby we can have a mobile primary care unit. This is happening now. The primary care unit is built into a 44-ton container, the sort of thing you see on lorries all over Birmingham, and it contains all the basic information and all the basic equipment you need for primary care, together with a doctor and a nurse. It stops at villages, for example, in Africa, which is where we're implementing it. The doctor and nurse stay there for a day, sort out the problems, but also the lorry is connected directly back to a main medical centre in some remote town. Why are we doing this? We're doing it because these people often have to walk for a week, carried on a handcart or something like that, to get to the major hospital. And a lot of these problems can be sorted out within their village.
Funnily enough, the technology is the simplest part. The challenge is getting people to adapt to a new way of doing things. But as Dick described, this is actually up and running at the moment, and there's every indication that it can be replicated in other countries around the world. 22,000 children die every day from entirely preventable diseases. That equates to 1 every 4 seconds, and as a paediatrician I find that mortifying. What could be done to redress that, or address that and redress that, is simply bringing medical knowledge and education to the people to prevent these unnecessary deaths taking place. It's a very simple message, and as Dick said, we're not advocating new technologies or technologies that have to be further developed. We're talking about using existing technologies appropriately to save lives, and we need to do it soon.